So this is Dr. S. Goel, MD Medicine, DM from top medical schools in Delhi and also MD USA and DM USA. So I'm making a video at this time. It's a very important video. Basically, I want to tell you what diabetes does to us. So let me tell you, almost diabetes has become rampant. Everybody knows that. And it is getting into much more and more younger people. So it is very important for us to, when we are youngish and we have no family history of diabetes, then we should at least once a year we should check our blood sugar, and there is a test, gold standard test, HbA1c. It tells your average blood sugar for last 3 months, and it is remains very constant around 5.5, 5.4. So as long as the number is constant, doing well, it means you are in good shape, your blood sugar is okay, you always come back to normal. But if this number is going up or your blood sugar is going up, then it means you are on the way to develop so-called high blood sugar or diabetes, and blood sugar may go higher and higher. The thing with diabetes is, the situation with diabetes is, it causes absolutely no symptoms for years and years, both diabetes and blood pressure. It happens so slowly that you do not have any symptoms, and at the end of the day you end up having all the complications of diabetes if you do not diagnose it, do not manage it. So I will recommend that is getting so rampant after age 30. If you have a family history of diabetes and in late 30s and 40s, you should test HbA1c every 6 months. It tells you average blood sugar for last 3 months. If it is normal, then you are in good shape. If it is going up, then you need to consult a physician, and you can be rest assured that eventually you will develop diabetes and all the complications of the diabetes if you do not mention it from day one. I have diabetes for last 15 years and I diagnose it. I've been checking I have a strong family history of diabetes. I've been checking my HbA1c and I'm managing it from day one. 15 years and I'm absolutely fine. No complications. I have checked. Basically, high blood sugar affects small blood vessels, which supplies, all our body organs. But most important is heart, kidney, and brain. So, with time, if we do not control it, eventually small blood vessels in the heart, kidney, and brain got damaged, and then we develop a very high risk of over years. It takes years. 10, 15 years. It happens so slowly. Then we may have sudden heart attack, or our kidney will fail. They will stop, as they are more and more damaged, they will stop cleaning our blood, and we will have to go on dialysis. Or in the brain, our blood vessels which supply the brain, can have a stroke. So what should we do? In the heart is called diabetic cardiomyopathy, and in the kidney is called diabetic nephropathy, and obviously in the brain it causes the stroke. So what should we do? So most important is we should get regular checkups every year. It is recommended anyway once a year when you are young. Here in US, insurance pays for every once a year total body checkup and all the blood tests. You should get it done. In India, even it's easy. You just order online. Somebody will come and take your blood, and then you can look at the blood test or HbA1c. But ideally, you should see a doctor at least once a year for a physical checkup. In any case, as soon as you find out your HbA1c is rising, you should take very good steps towards managing your diet, your blood sugar, consulting a physician, you can find a specialist who manages the blood sugar. So in such a situation, if you break the vicious cycle and there are tons of medicines available for management, very good medications available for management of the diabetes. So where you can keep the your blood sugar under control, and you will be fine. You will stay healthy. Nothing will happen, in the long run. Your kidneys will be protected, your heart will be protected, your brain will be protected, and also you hypertension is another thing. With the age, we do develop high blood pressure, and we should, it happens mostly after age 40, and we should obviously manage our blood pressure also. So with the blood sugar, when blood sugar, your body cannot utilize blood sugar, your cholesterol level jumps up, and that is what happens in diabetes. That is part of the whole process, and cholesterol, goes and sticks in these small blood vessels. So one has to understand that. So one has to control both blood pressure, sugar, cholesterol, and it's only practical possible if you follow a doctor regularly. And like I said, you manage it, you will do well, you will have a long, healthy life. Your family will be thankful. Thank you so much. Bye.